thanks for joining us. Mary, good to see you. Carol, hello. Mike, thanks for coming. Patty, Catherine, Ron, I hope that I don't know if that R it's Ron with R, your last name begins with R, but the whole thing is pretty darn cool. Ron, thanks for joining us.
That's Ron. Judith, R stands for Rosen, but thank you.
Just go with Ronner. It's cool. It's got a growl to it, Ronner. Donna, good to see you. Isis, Kevin, hello everybody. Thank you so much for coming today. We have the purpose of today's call is to discuss the Cycle 45 grant that the State Council on Developmental Disabilities has issued. We have a PowerPoint that you should be able to view. There it is. Confirming everybody can see that. That's great. And all right, so let's dig into it. Again, the intention of this presentation is to provide you guidance for anybody who's interested in applying for this grant. Hope you each are. Provide you some background information. We want to go over the Cycle 45 request for a proposal, which I'll just refer to from now on as the RFP, request for proposal. Go over the application process and explain how you can apply. This call we anticipate to be 60 minutes. I'll speak for a while and then open up to questions and answers. But if we don't go for 60 minutes, we'll end early. We will not go longer than 60 minutes. Next slide, please. Want to thank the excellent team from the State Council on Developmental Disabilities who's here today. Christy Allensworth, she is our contracts analyst. We'll call her the contracts lead, the contracts manager, the contracts guru, anything contracts going through the State Council on Developmental Disability. Christy is the person. So you'll see her name on the emails and the RFP and the documents, but she's the first point of contact. Christy, thank you for all that you do for these. Rehana is the manager for the state plan and self-advocacy. The state plan and self-advocacy is why the State Council exists. It's our agreement with the federal government, with Congress specifically for the dollars they give us, and it's our agreement with the community who we craft a plan with input from the community. There are about 6,200 people who lent their voices to the current 5-year plan we're working on. So Rehana is the manager to make sure that we're keeping our commitments to the community and to the federal government. This grant process is part of our state plan work. So thank you, Christy. Thank you, Rehana, for the work that you do today, for this call, and of course, every day. Next slide, please. The details for this meeting is that live closed captioning is active. I just want to pause for a moment and confirm that it's active and functioning. Someone can let me know.
Yes, it is available. If they need, they can just click on it on the bottom.
Great, thank you. This meeting is being recorded. It will be posted, and you'll have access to it on demand. The materials for the grant will also be posted on the SCDD website. Just to let you know, we have muted all participants to keep background noise to a minimum. But after the presentation, we'll open up for questions and answers. I can see that the chat function is active. There's questions and going into the chat. I'm not able to, the way my screen's displayed, I'm not able to see the chat. And so when we get to the Q&A, I'll look through those for any questions. But Christy and Rihanna, if you see questions that I need to answer, please let me know. Next slide. But how do you get your questions answered? Write them down, please. Ask them at the end of the presentation, or you can just submit them to Christy, and you have up to July 11th. So hold all your questions until the end. Hopefully we answer some of them as we go through. You can ask them in this form. You can also submit them through the RFP process, and we'll do Q&A at the end. Again, at that point, we'll take everybody off mute and start taking additional questions. So the State Council on Developmental Disabilities, we are authorized in both federal and state laws. We are here to be a guiding force for positive, life-altering changes in the lives of people with developmental disabilities. We're here to ensure that the rights of people with intellectual developmental disabilities are protected, upheld, and we do that through advocacy, capacity building, which means training people to be their own advocates, and systems change. We advocate for and promote and implement policies and practices to achieve self-determination, independence, productivity, and inclusion in all aspects of community life for California with intellectual and developmental disabilities and their families. Going back to that comment that we're here to promote and implement policies and practices to achieve self-determination, that's both formal, the self-determination program in California. It's also the philosophy that goes throughout all of our work. I'm located in calling you from headquarters in Sacramento. We also have 12 regional offices throughout the state who you may work with. We exist in the Federal DD Act and we exist in the State Lanterman Act. Next slide. Remember, this is just an overview of the RFP application process. For more information about the RFP and the announcement, check out our website, scdd.ca.gov. Everything you need to know about the program, including all of the requirements, are in the links and the documents on the website. This call is intended to be a high-level summary of the request for proposal process. It's meant to only be an overview of the program and highlight some key details, and hopefully give you some tips to be helpful. It's not meant for, it should not be used for as a replacement for reading and reading the RFP itself. Next slide. The big reminder, the RFP is whole, it is complete, and it is authoritative by its very definition. Next slide. So in handouts, when you go to our website, there are a number of documents there to help guide you through and aid you in applying for the RFP. There's a proposed checklist. So if you got the checklist, you follow it, you make sure you're submitting everything that's needed. There is a template for a project narrative, a template for a project, a data sheet and a budget detail sheet. They tie together. We're going to add California poverty levels. We'll talk about that in a minute, and also talk about SCD performance measures, and you'll also find previously asked questions and answers there. So I'll be referring to these handouts as we go through the presentation together. So with that amount of overview, let's get into this cycle grants and what the State Council is looking for. Next slide. So every year, the State Council provides funds for new and innovative projects that address goals and objectives in the Council's 5-year state plan cycle. These projects will develop or support promising or best practices in the field of intellectual and/or developmental disabilities. So what does this mean? This means that a new promising practice will be created, demonstrated. Promising practice will be improved or supported and demonstrated. It also could mean a best practice will be created and improved or supported and demonstrated. So this annual funding process is just one way that the Council works to meet its obligations to the community and to Congress. These are unique dollars. They're very rare in the system. They are dollars that exist to come up, to try something new, try a promising practice, try a best practice, try one of these in a different way. Oftentimes these the results of these projects have turned into much, much larger efforts. One of the most recent ones is the council funded a proposal that wanted to create outcomes and performance outcomes and measurement outcomes for the system. We have a system that's based on individuals, individual needs, individual plans, individual desires, and person-centered planning. Well, how do you take the results of an IPP and measure the system itself on an aggregate to see if it's performing well? That's a pretty darn hard task. Someone proposed and the council said that would significantly, knowing that answer would significantly improve our system. When dollars go in from the governor and the legislature, the council wants to make sure that people who are being served by the system are the ones who are benefiting and that their lives are better for it. So someone pitched that, CCLN pitched that idea, the council agreed, and at the end they had not the answers, but they had the seeds to the answers. And they took those seeds of the answers into the legislature and said, this is what we've been able to develop. This is what we're looking for. We would like to, with the legislature, put more money to help this grow. And the legislature agreed, and last year put in $10 million for it. So again, give that example as a way that these dollars are very unique in the system. They allow us to spend money on new ideas. If you're things that, oh gosh, we just wish this could happen, or this could be, or we could prove this. These monies allow us to do that, and then allows us to take the results after they're demonstrated and proven and try to change the rest of the system with it. So there's an overview. The council this year, next slide, again has, wait for the next slide. There we go. Available funding. The council has a total of $260,000 available to fund projects for this cycle. They are interested in projects that can be in any one of the 4 areas: education, early intervention, or identification, employment, health and safety, or housing. The council will consider all proposal submissions and choose 1 or more projects within the budgeted amount. So within a total of $260,000 out of 4 different areas, they understand that the final list of approved projects may not address all 4 areas, and nobody needs to submit a project that addresses all 4 areas. But whatever is submitted will be scored, it'll be ranked, and the highest ranking one is the one the council will consider for funding. Depending upon what the highest ranking one asks for in funding, there may be additional dollars available. So that could then go to fund the second highest ranking one. Next slide, please. So I want to give you some information about each of those 4 areas, unpack them a little bit so you understand what the council is looking for in those 4 areas. Next slide. The first area is education, early intervention, and identification. So the State Council is invested in ensuring that all California families and individuals with intellectual and developmental disabilities have access to culturally competent, disability-related early identification intervention services, education, and generic community-based supports and services. The council is seeking a grantee to build capacity in families and children at risk of developing or acquiring IDD with underserved communities who are eligible for and may already be receiving developmental disability-related services or special education within a least restrictive environment. The council recognizes that underserved communities may include African American, Black, Asian, Latino, Latinx, etc. Could include low income, inner city, could be deeply rural communities or individuals or families who are homeless, have high needs or in foster care or licensed care, families who are bilingual or non-English speaking, or those from native Californians or tribal sovereign areas of California. SCD is interested in funding a project in this area that will provide culturally competent curriculum. That could be developmental milestones, early intervention, FAPE rights, Lanterman Act eligibility, due process, advocacy. So providing culturally competent curriculum, training, referrals, information and resources, and advocacy to support tribal families of at risk of developing or acquiring IDD, or those who are receiving special education or regional center services. But also, council is looking for providing culturally competent, plain language, standardized checklists to assist families of at-risk infants or toddlers in communicating health developmental concerns. So it could be developmental milestone delays, behavioral issues, vision, hearing deficits to health practitioners. I said a lot, and in that, it's trying to give examples and ideas without being comprehensive. So it's a lot of examples and possibilities of what the council is open to, but also wanting to leave you to your best creativity of how to address this area. Whatever your idea is, the project must provide families with one-on-one technical assistance and modeling of effective strategies to develop and implement culturally competent IEPs, IFS, IPPs for families and children at risk of developing or acquiring or may have IDD. This one-on-one technical assistance must be provided in underserved communities eligible for receiving special education or regional center services. This project must produce a report at the end that identifies real and or potential barriers, that identifies best and or promising practices and effective strategies in assisting underserved families to obtain timely regional center early identification or intervention and special education services for eligible children. The project, whatever the idea is, so come up with the idea that can do this, provide a report at the end that identifies barriers and best practices, but in the end, it should serve as a model that can be replicated by developing innovative, promising, or best practices. Again, that model of a seed of a new idea or of trying two different ideas together that have never been tried before, and in the end, a report on how it went, and that it should be replicable by others. So that is education, early intervention, or identification. I'd now like to move on to employment. So under employment, the council is seeking a grantee to increase the capacity of individuals with IDD who are experiencing underemployment, unemployment, or an economic pandemic-related layoff to obtain competitive integrated employment. So the council is invested in ensuring that all California job seekers with intellectual or developmental disabilities have an opportunity to access quality, individualized employment discovery, preparation, placement, and support. The council is seeking a grantee to increase the capacity of individuals with IDD who are experiencing challenges in finding competitive integrated employment. CIE summed up as real work for real pay in real places. So the council is interested in funding a project that will develop or provide curriculum, resources, or training, technical assistance, and skill acquisition for individuals with IDD to be able to gain employment. They're interested in a project that will deliver discovery model preparation work, job development, or innovative, promising best practices in job development. Interested in funding a project that will provide culturally competent IDD-related information and technical assistance supports for employers, for trade associations, for unions, and for other entities who the job seeker will engage with. Also interested in funding a project that will provide connections and pathways for ongoing post-placement employment services. So all of these things I just said were all ORs. It's not a project that does every single thing I said. Again, it's projects that do one or more of these things. Again, the project needs to serve as a model that can be replicated by others after you've figured it out, whatever innovative, promising, or best practice that you use. The project grantee will have to demonstrate subject matter expertise in competitive and integrated employment and customized employment. The grantee will also have to have demonstrated cultural competence in the field of IDD and IDD specifically in culturally, economically, ethnically, geographically, linguistically diverse underserved populations. Priority will be given to projects that focus on diverse, underserved populations of individuals. So for example, Black, African-American Californians, Asian, Latino, Latinx Californians, or the other groups that I talked about before, low income, bilingual or non-English speaking, inner city, or deeply rural populations, individuals who are homeless or in licensed or foster care settings, or individuals from native tribal communities throughout California. Next slide, health and safety. The State Council is seeking a grantee to reduce service barriers and ensure the health and or safety of people with IDD by facilitating improvements in communication and interactions between families and people with IDD and first responders, healthcare professionals, mental health providers, and or correctional personnel. The State Council is very invested in ensuring that California families and individuals with IDD are able to just engage safely and effectively when coming into contact with health or safety-related personnel. Whether they're in the community, they're licensed, it's in their own home, or they're in institutional settings. So the council is seeking a grantee to reduce service barriers and ensure that the health or the safety of people with IDD by facilitating improvements in communications and interactions between families, people, and IDD with first responders, healthcare professionals, mental health providers, and law enforcement. The council is interested in funding a project that will provide IDD-related curriculum resources or information, in-class training, technical assistance, support for public health, safety, or emergency response professionals. This could include, but certainly not limited to, law enforcement officers, correctional personnel, emergency or 911 dispatchers, fire personnel, EMS, EMT, paramedic, transport responders, emergency room personnel, medical professionals, mental health providers, curriculum or resources that helps individuals communicate with those professions. The project could be that, or the project could be providing culturally competent health or safety related plain language curriculum, resources, training and referrals, technical assistance and supports to individuals and families to identify needs, communicate concerns, and effectively and safely respond to and ask and answer appropriate questions when interacting with emergency responders, law enforcement, or healthcare mental health providers. So the project the council is looking for is developing curriculum to help train on communication or providing that one-on-one assistance to individuals on how to interact with law enforcement. As I read this, I'm also thinking, well, what about law enforcement? What about public safety officers? What about mental health? What about healthcare professionals? They need training too in how to interact with people with intellectual and developmental disabilities and their families. If you're thinking that, you're right. They do need that, and there are other entities who are developing that. There's a number of different efforts, especially with law enforcement, to make sure that there are good interactions, interactions that don't lead to some awful, horrible situations that we've heard about recently. This one's specifically focusing on families, which is where the council wants to shore up and give families additional resources, give people with intellectual and developmental disabilities additional resources and supports for this dynamic that is needed, is necessary, will happen, but may have bad outcomes if not done in a way where people are really understanding each other. Again, this project, whatever comes of it, should be able to be replicated by others. And the project grantee has to have demonstrated subject matter expertise in one or more of the following areas: healthcare, mental health, law enforcement, public safety, or emergency response, or the related fields. So whichever of the areas you're wanting to develop curriculum, you'll need to have demonstrated subject matter expertise in that area. And bidders should have demonstrated cultural competence in the field of intellectual and developmental disabilities, and have demonstrated cultural competence in working effectively with linguistically, culturally, economically, and ethnically diverse communities of people. So next, our last one, and thank you so much for your patience as I go through each of these in detail. I'm largely giving you every part that is on the descriptions within the RFPs about these different areas so that you understand them. But again, what is online and what's printed is the authority. So please, as I'm describing these, if any of these spark interest, go to the resources online. But here's our last one: housing. The council is seeking a grantee to build the capacity of families or individuals with IDD to engage in housing-related advocacy efforts and to understand tenant and housing rights and subsidized housing programs, obtain independent living services or supported living services, and explore a variety of housing options, including home ownership. So the council's been invested in ensuring that families and individuals with intellectual and developmental disabilities have the resources, have the knowledge to advocate for and obtain affordable, safe, accessible housing in their communities and homes of their choosing. This is the core, this is the essence of community-based living. The council is seeking a grantee to build the capacity to engage in housing-related advocacy efforts and to understand tenant and housing rights and subsidized housing programs, to obtain ILS or SLS, and explore a variety of options. So this could be a project that develops a plain language toolkit or curriculum, could develop information or tips about housing and tenants or renters' rights. That could include maintenance, eviction, fair housing standards. The toolkit could include subsidized housing program, information about subsidized housing programs, funding options, planned or available housing options, local, regional, state policy entities associated with housing issues. A project could develop this toolkit, or a project could provide technical assistance. That's our term for just one-on-one giving advice. It could be both, toolkit and providing assistance to individuals who are looking for housing. Again, like the others, if you're picking this, you need to have demonstrated matter expertise in housing, as well as working with people with intellectual and developmental disabilities and their families, and have demonstrated cultural competence about IDD, and working with linguistically, culturally, economically, and ethnically diverse people. So those are the 4 areas in deep and with specific descriptions. So now I'd like to move on to the grant rules. So once approved, projects will begin on October 1st, 2022, and must be completed by September 30th, 2023. This is, why those dates? Those dates are the federal fiscal year. Our funding is federal, comes from Congress. We are a line item in Congress's budget. So the federal fiscal year begins on October 1st and September 30th. So that is the time frame for these grants. Proposals must be consistent with all applicable federal, state, and local government laws and regulations. Next slide, please. Proposals must meet the needs and intent outlined in the project description, which I just went through in detail. You'll find that and they must serve individuals who meet the federal definition of an intellectual or developmental disability. Now, the federal definition, we are an entity that is authorized in federal law, the Federal DD Act, and the federal definition is a little bit different than the state definition. So let me go over that in some detail. The Federal Developmental Disabilities Assistance and Bill of Rights Act of 2000 defines a developmental disability as a severe chronic disability of an individual that is attributable to a mental or physical impairment or combination of mental and physical impairments. That is attributable to a mental or physical impairment or combination manifested before the individual attains age 22, not 18 like in California, likely to continue indefinitely, similar to California, and it has a condition that results in substantial functional limitations in 3 or more of the following major life activities: self-care, receptive and expressive language, learning and mobility, self-direction, capacity for independent living, and economic self-sufficiency. The 3 or more of those 6 areas. This includes infants and young children from birth to age 9 who have substantial delays or specific congenital or acquired conditions, may be considered to have a developmental disability without limitations in meeting 3 or more of the major areas of life activity, with a high probability of resulting in developmental disability later in life if services are not provided. So the federal definition of early intervention is similar to the state's definition of early intervention, which really is a functional definition of early intervention. The main differences, again, between the state and the federal definitions are onset of age. California is 18, feds is age 22, and then again, the federal definition is a functional definition, whereas the state is a diagnosed approach, with category 5 becoming a functional definition as it relates to similarly manifesting similarly to an intellectual disability. I hope that was clear as I tried to make the distinction between what federal and state definition is. But for the purpose of this grant, you can apply based on the federal definition. Next slide, please. Who's eligible to apply? Well, grantees must be entities or individuals with a taxpayer ID number, and that can provide the required fiscal assurances and then meet all the requirements of the RFP. Next slide. But there are some funding restrictions. The federal government has produced a list of what's allowable and what's not allowable under the money that we receive from Congress. So if you have questions, please just submit them in accordance with the RFP guidelines, which means sending Christy an email. Next slide, please. Evaluation criteria. So this purpose is to tell you, as the applicant, what elements will be scored for all criteria. It's very important that you read the evaluation criteria as well as the other sections of the RFP thoroughly. This is the scoring rubric. So this is exactly what we score proposals based on. Next slide, please. Yeah, proposal evaluation criteria includes project description, how closely it ties and links with our state plan. Does it have the targeted population that it should? Does it include evaluation and reporting? What are the deliverables or outputs of the idea? What's the methodology for the proposal itself? How well does it address diversity or disparities? Is the budget clear, supportable, accurate? Are the bidders knowledgeable and have experience? And does the idea itself fit the criteria of being innovative or having that creativity? So each eligible proposal will be scored, could be up to a maximum of 120 points. And again, just handing you the rubric right here. So these are in the materials, go to them, please. Minimum score. A minimum score of 75% is required to be, next slide, please. Minimum score of 75% is required to be considered for an award of a contract grant. Any proposals that fall below 75 when scoring overall are not considered to be granted. I want to tell you about some of the steps. Even before we even get to scoring through that rubric, there's an administrative review that's important. In the administrative review, next slide, they're looking at your cover letter, your project data sheet, confirming and making sure the project narrative is there. The project narrative has the methodology, it has, which we'll get to as Exhibit A, and also has the outcome measures and evaluation. I'll tell you, there's many proposals that we get that don't get to the administrative review just because the fundamental instructions haven't been followed. One of the biggest lessons from prior rounds is check your budgets. Make sure they're accurate, make sure they're lined up, make sure they have the right amount of match. Let's talk about match now. Next slide. Exhibit A talks about what match you would need to bring to your proposal. And the federal government defines that really based on the location that you are doing your project, your idea. If that area is a federally identified poverty area, it changes the percentage of match that you need to bring. So a 25% match is required for non-poverty areas. A 15% match is required for poverty areas. So a match may be fiscal and it may be in-kind funding. So when you're looking at preparing your total budget, look at Exhibit A, which will be updated in the next few days online, and look to see whether the area you're going to do your project is identified as a federal poverty area, because that will change what your match needs to be. Again, it's important. This is one of the biggest areas that we see proposals get disqualified because there just isn't the right percentage of match coming. Next slide, please. Exhibit B. Exhibit B there are performance measures that are used to determine and report activities and outcomes and provide consistent evaluation metrics for your proposals. So for example, there are two different types of performance measures. There's performance measures for individuals and families, and there's performance measures for systems change. If a proposal will provide training to self-advocates, the intended outcome will identify the number of self-advocates you intend to reach and the number of people with developmental disabilities who participated. That would be under the performance measure for individuals and families. Likewise, if your training is aimed at serving family members, then it would also be included under the individual and family performance measure. If your aim is to train professionals, you'd use the systems change performance measure. If you're going to change a policy, if you want to change a statute or regulation, that'd also be a systems change performance measure. So being very clear about what the intention of your project is will help you determine which performance measure that you're saying will be needed and accomplished through this project. Next slide, please. Well, I said it before, I guess I'm saying it again. Double check to ensure that your numbers all match in your budget detail worksheet. Next slide, please. Required attachments. So there is the proposal checklist. Proposal checklist tells you everything you need. But also, as I mentioned before, you'll need an organizational chart. Need information on the personnel who will be involved in the project. And just let us know if you've been, if any previous grants are awarded by SCDD. Other required attachments, 3 letters of support. This is important. If you are working with another entity and they're going to be a key entity in the work that you're doing, make sure there's a memorandum of understanding or a letter of commitment from that other entity saying, yes, we know what's happening, we are committing that we would be part of this in the way that's specified in the RFP. If you are an entity that needs approval by your governing board to pursue this, please include that too. Next slide. I want to go over for you what to expect. So I mentioned before, proposals will go through an administrative review to ensure that there's all the necessary documents are included, the formatting is corrected, the numbers submitted are corrected, and the checklist has been completed. It seems pretty simple. It's pretty straightforward. It is the administrative review. Again, we lose a lot of great ideas at this point of the process. Next slide. Proposals that make it through the administrative review will go to a scoring panel. Scoring panel will make its recommendation to the State Plan Committee in August of 2022. Next slide. The State Plan Committee will make its recommendations to the Executive Committee also in August of 2022, and public notice will be posted in August of 23 that will begin the protest period. Protest period ends on September 5th. Last slide, or next slide. What to expect? The official award notification was made on September 6th, 2022. Next slide. Here's the tips. I hope they're helpful. Talked about common mistakes, and let's talk about them again. So how to avoid common mistakes is to read the entire RFP, follow the format guidelines, double check all the eligibility requirements, and use the proposed checklist. Or hope to give you all the tools that you need to be successful in it. And we know that by following that, it'll increase your likelihood of success. Next slide. To avoid common mistakes, be sure you're proposing a project that's consistent with the mission of the State Council. We actually have seen many ideas. People spend a lot of time and a lot of work proposing something that's not even in our mission. So be clear on our mission and what our values are and what we're trying to accomplish, and you're proposing an idea that's consistent and promotes those. Next, address each of the areas within the criteria for evaluation. You largely just have the scoring rubric, follow it, and proofread the proposal before submitting. Just to make sure that people scoring the proposal, we can only score based on what you've written. So if there is something that you intend, be explicit about it, be clear about it. We cannot infer anything into what is written. Everything needs to be on paper. Next slide. Mail your proposal in early or deliver in person to avoid missing the deadline on July 27th, 2022. We are moving quickly, and so you want to make sure that yours is in. 5 p.m. on July 27th is the drop dead deadline for SCDD to receive your proposal. So I said I'd speak for 45 minutes. We're at 11:46, so that was pretty darn close. Thank you. Thank you so much for attending this pre-bidders conference. Thank you for your interest. We'll now unmute the lines and take questions. And we're a small group, so we can pop in, but I think I'd like to, as I said before, I'm not able to see the questions. So Christy or Rihanna, if there are questions that came through in the chat that I should address first, let's start there, and then we can just go to other participants.
Hi, we have received just 2 questions. One's from Judith Doodle, and she's wanting to know if this is the first time for this grant, or have we done them in the past? I don't know if she's referring to general or these specific topics.
Well, Christy, I think what I heard you say is there was a question asked whether or not this is the first time that we've done this grant, or have we done it in previous years. You said something else I didn't hear after that. Could you please repeat that?
I said I'm not certain if she's talking about grants in general or if these specific topics.
Oh, I see. Judith, if you're still here, do you want to come off of mute and let's talk about your question?
I don't believe she's still here.
Okay, well, good questions from Judith, and now I can see the chat, and it looks like there is other good questions from Judith. So the State Council has issued these program development grants We call them program development grants because they are, again, dollars for innovative ideas to develop new ideas, new programs. This is their 45th cycle, so it's cycle 45, so I've done it 44 times before. But if it's done the first time for this grant, every year the council picks different priorities that are pressing, and these were the priorities the council picked for this year. I see that Judith also in the chat asked, can we include those who are not currently served by Regional Center? For an example, in Orange County Regional Center rejects about 2/3 of the people with autism, but they have needs. As long as individuals meet the federal definition, and we estimate that well, we know in California there's about 360 people served by regional centers. The feds have a prevalence estimate rate that they use for people who meet the federal definition. That number is at about almost 700. So yes, you don't have to serve people who are being served by the regional center, but as long as they meet that federal definition. Looking through the chat, Rihanna, thank you so much for putting links into the text of the descriptions that I went into great detail about, and I thank you all for your patience in listening to them. Of course, you can email questions to Christy Allensworth, and her email address is now in the chat. You can do that until July 11th. Let me see, there's just a few of us here. So I was going to go around the room. Mary, are you still there? Do you have any questions? How
No,
about
I don't.
Carol? Carol, oh, okay, thank you, Mary. Carol, any questions for you?
Not at this time, but thank you for having me.
Thank you for being here. Mike.
If it's me, yeah, I have a question. I'm with Rady Children's Hospital, San Diego, and we're wondering, we saw that there was mention of being a community-based organization, and we wanted to know if like a not-for-profit hospital serving children with disabilities would be considered a community-based organization that would be eligible to apply.
Mike, it's a good question, and it's one your organizational structure falls into an area that is not a clear yes, not a clear no. Would you please email that question directly to Christy Allensworth, whose email is in the chat, and we'll research it with our legal goal and get back to you with a clear answer about where you fall.
Okay, thank you. And then I had one more brief question is, in terms of
Sure.
program evaluation, so this is a 1-year grant, when would the actual program evaluation be reported? Would it be before the timeline ends, so at the conclusion of the year, or would we have a follow-on period where we could report the outcomes?
Well, I'm going to confirm with Christy and Rihanna, but I believe the evaluation would be included, the results of your evaluation would be included in your final report. Rihanna,
Yes.
Christy?
Yeah, generally grantees are submitting bi-monthly reports, and then at the last report we do give a little wiggle room for a couple months, but we do have to do our federal reporting by December. So if you're ending the project September, we would need kind of the data by the end of October, early November at the latest.
Great, thank you.
Thanks for that clarification, Rihanna, because ideally we get it in your final report, but we also understand you may need time after the work is done to finish the evaluation. So there is a month and a half of wiggle room. Thanks, Mike. And please do email that other question. Christy and our legal team are pretty fast in our turnaround. So thank you. We'll look forward to it.
All right, thank you.
Patty, any questions for you?
No, thank you.
Thanks for being here. Catherine.
Hi, yes, I do have a question. Can you hear me?
Yes.
Oh, good. So we employ 3 young adults with autism, and we have been for years, and we're training them to be workshop directors and actors. And we're, committed to them for the long term, but our numbers are small. it's an innovative program, but I just don't know if we're too small to apply.
Well, Catherine, the idea is that if you have something that is new, that is innovative, that is a promising practice or a best practice, and you're looking to prove its effectiveness, then that's what this project is looking for. Prove its effectiveness in a way that can be evaluated, demonstrated, and then replicated throughout the state. Doesn't necessarily have to be replicated by you, but is replicated by others. Made available, we would make it available and promote it as a best practice and a proven practice for others to follow.
Well, I think that has potential, and the way that we record or evaluate is that the 3 young adults with autism answer questions about whether we're helping them in their professional goals and build their careers and things like that. So I don't know if our evaluation practices are enough for this grant.
Well, please read the materials online, and if you think you fit, please consider applying. It's not knowing your program, and all I can do is point you to the resources for you to review and consider.
Okay, thank you.
Thank you, Catherine. Ronner.
Excellent presentation. No questions at this time. If I do, I'll send an email to Christy.
Great, thanks, Ronner. Appreciate it. Isis.
Thank you. No question at this time.
Well, thank you for being here, Isis. Kevin, I see you have a question there. Are there any specific geographic coverage requirements? Do you want to come off mute and tell us what you're thinking?
Yeah, just thanks, Aaron. Just trying to see if we should focus on, since we have like a 8-county coverage area, should we focus on any specific subcategory of that geographically, or just like our whole service area, anywhere we can have a direct impact? Or usually when you have these broken down by regions, then we would apply just for whichever region is like Central Coast or Bay Area or whatever. But now that you're kind of revamping the cycle, is it okay to just focus on any area that we choose or within our coverage area?
Yes, I believe the answer is any area or any combination of areas within your coverage area, but I'll check and confirm with Rihanna.
Yeah, this cycle is open statewide, so as long as it's in California, and it's open to any region in California.
Okay. All right. Thank you both. And thank you, Christy, too.
Great. Thanks, Kevin. C. Nava asks, is the email submission of proposals permitted? Christy, would you like to take that question?
I'm sorry, could you repeat the question?
Yes, C. Nava asks, are email submissions of proposals permitted?
No, they're not. They have to be either hand delivered or submitted by US Mail, FedEx, UPS, something like that, but we do not take email delivery.
At this point, it's paper only. Thank you, Christy. C. Nava, any other questions for you?
No additional questions. Thank you.
Thank you very much. Councilmember Mike Ellis. Hey, Mike, we see you. It looks like you're off mute, but we can't hear you. Your hand's up, we can see you, you're walking around, but still can't hear you. Can you put it in chat, or maybe even just text me and we'll cover it. Last person on my screen is someone who's phoned in. I just see area code 559-779-7806. Hi, caller, do you have a question? No questions from the phone. Still giving a moment for Mike Ellis to get his question in either through the chat or through text. In the meantime, anybody else have called on? Anybody else have another question? All right. Seeing no other questions, and Mike says he'll submit his question by email. It looks like we have it covered. So I hope this was helpful. Hope it was encouraging. Hope it was exciting because, again, there just aren't any dollars like this in the system. They are rare, they are unique, and there are changes that have happened in the system because of these small little bits of dollars that plant seeds that grow into big things. And we're excited about the possibilities and the ideas you have under those 4 categories. So looking forward to your proposals. Again, any questions, please send them in. And I look forward to reviewing the proposals that come in. So thank you, everybody, and have a good Monday.
Thank you.